Hi, I'm Dr. Andrio, Professor of General Surgery and Alternative Surgery. The focus of naturopathy is on its philosophy of natural self-healing, rather than specific methods, and practitioners use a wide variety of treatment modalities. Many methods rely on immaterial, vital energy fields, and naturopathy as a field tends towards isolation from general scientific discourse. The effectiveness of naturopathy as a whole system has not been systematically evaluated, and efficacy of individual methods used varies. A consultation typically begins with a lengthy patient interview focusing on lifestyle, medical history, emotional tone, and physical features, as well as physical examination. Naturopaths do not necessarily recommend vaccines and antibiotics, and may provide inappropriate alternative remedies even in cases where evidence-based medicine has been shown effective. All forms of naturopathic education include concepts incompatible with basic science, and do not necessarily prepare a practitioner to make appropriate diagnosis or referrals. The particular modalities utilized by an individual naturopath varies with training and scope of practice. The demonstrated efficacy and scientific rationale also varies. These include acupuncture, applied kinesiology, botanical medicine, chelation therapy for atherosclerosis, colonic enemas, color therapy, cranial osteopathy, hair analysis, homeopathy, iridology, live blood analysis, nature cure, a range of therapies based upon exposure to natural elements, such as sunshine, fresh air, heat, or cold. Nutrition, examples include vegetarian and whole food diet, fasting, and abstention from alcohol and sugar. Ozone therapy. Physical medicine includes naturopathic, osseous, and soft tissue manipulative therapy, sports medicine, exercise and hydrotherapy. Psychological counseling, examples include meditation, relaxation, and other methods of stress management. Public health measures and hygiene, reflexology, rolfing, traditional Chinese medicine. Naturopathic care is available from three broad categories: practitioners with a 4-year degree or similar formal training, practitioners who are self-taught or have been apprenticed to another naturopath, and practitioners who operate under another professional license, while also offering some naturopathic methods. In unregulated jurisdictions, the designation Doctor of Naturopathy and similar terms are not protected, and may be used by any practitioner, regardless of qualifications. Naturopathic Doctor, ND, or a similar term is a protected designation with some form of licensing and training requirements in at least 15 U.S. states, the District of Columbia, and 5 Canadian provinces. In these jurisdictions, naturopathic doctors must pass board exams set by the North American Board of Naturopathic Examiners, NABNE, after completing academic and clinical training at a college certified by the Council on Naturopathic Medical Education, CNME. Many naturopaths present themselves as primary care providers. ND training includes the use of basic medical diagnostic tests and procedures such as medical imaging, minor surgery, and blood tests. The CNME also provides for the inclusion of optional modalities including minor surgery, natural childbirth, and intravenous therapy, though they are not generally licensed to perform these functions. These modalities require additional training, and may not be within the scope of practice in all jurisdictions. This training differs from that undertaken by MDs in that it includes scientifically disproven modalities, such as homeopathy, often called pseudoscience, and quackery, and concepts irreconcilable with modern medicine, such as vitalism. MDs do not engage in residency training. In 2005, the Massachusetts Medical Society opposed licensure in the Commonwealth on these grounds. The core set of interventions defined by the Council on Naturopathic Medical Education and taught at all 6 accredited schools in North America includes acupuncture and traditional Chinese medicine, botanical medicine, homeopathy, nature cure, a range of therapies based upon exposure to natural elements, nutrition, physical medicine, and psychological counseling. Traditional naturopaths are guided by the same naturopathic philosophies and principles as board-licensed naturopathic doctors, and often prescribe similar treatments. Traditional naturopaths, however, are not primary care providers, whereas graduates of CNME-accredited naturopathic medicine schools are classified as both alternative or complementary practitioners, as well as primary care providers. Traditional naturopaths may voluntarily join a professional organization, but these organizations do not accredit educational programs in any meaningful way, or license practitioners, per s.e. The training programs for traditional naturopaths can vary greatly. Compared to naturopathic medical schools, traditional naturopaths training programs are less rigorous, and do not provide the same basic and clinical science education. The professional organizations formed by traditional naturopaths are not recognized by the government of the USA, or any US state or territory. According to a 1998 task force report, some physicians are choosing to add naturopathic modalities to their practice, and states such as Texas have begun to establish practice guidelines for MDs who integrate alternative and complementary medicine into their practice. Continuing education in naturopathic modalities for healthcare professionals varies greatly, but includes offerings for many professions, including physicians, physical therapists, chiropractors, acupuncturists, dentists, researchers, veterinarians, physician assistants, and nurses. These professionals usually retain their original designation, but may use terms such as holistic, natural, or integrative to describe their practice. Thanks for listening.